People with heart failure have been strongly recommended to reduce their salt intake. Do we have any evidence to back up this recommendation? That is what we discuss in this video. People with low ejection fraction are traditionally suggested to stop their salt or limit their salt intake. To address this question, a couple of years ago, there was a study which has been published called as the SALT HF study, where they studied 1000 patients with restricted salt and another 1000 patients without restricted salt. Those in the restricted arm received about 1.5 gram of salt per 24 hours, whereas in the non-restricted arm, they did not have any such restriction. It has been shown that at the end of 5 years, there is no significant difference in the death, in the rehospitalization rate, and in the general other complications related to heart failure in those patients who had a restricted salt intake. So the studies indicates that by restricting the salt, there is no great evidence to reduce the event rate. But despite these studies, the American Heart Association still recommends to restrict salt so that the event rates are low. We have to see whether in future this recommendation might be amended. The second point which comes from these restriction of salt studies is the restriction of salt leads to reduced food intake, especially the required nutrients as well as micronutrients. So those patients who have been restricted salt intake have been found to be micronutrient deficient, and that led to a further worsening of their underlying condition. The third point what I would like to add upon to this is, in countries like India, which are very hot countries, by restricting the salt, these people are prone to loss of lot of water and sodium because of the hot temperature. By restricting the salt in this group of patients, these patients develop a low blood pressure. When the patient develops a low blood pressure, the doctors immediately reduce the doses of the medicines or sometimes eliminate certain medicines which are very important for the heart. So in fact, by cutting down the salt and leading to low blood pressure, and that low blood pressure cutting off the important medication worsens the heart failure. So that is another important point which we need to keep on our mind whenever we treat these patients. Finally, whenever patients with heart failure with low ejection fraction, when you cut down the salt, 3 points one has to remember. One is restricting the sodium did not reduce heart failure, did not reduce death rates compared to those with normal dietary intake of salt. Despite this, American Heart Association recommends salt restriction. The second point is restriction of salt leads to a micronutrient deficient food intake that leads to worsening of the heart condition. The third problem is restriction of salt leads to low blood pressure, and this low blood pressure leads to curtailing the dose of the medication, which can further worsen the heart failure. In conclusion, if we want to focus on the management of heart failure, the focus has to be more on guideline directed therapies like drugs and devices rather than restriction of salt.